In the heart of Yorkshire, our health service is hard at work.
Barnsley A&E.
They'll be here in a minute.
A dedicated team working around the clock in Casualty.
Just waiting for that bed to be ready.
Ambulance crews all the way up that corridor.
They're with us for our most vulnerable moments.
Don't get upset, you'll get worse.
God almighty.
Sorry.
Facing life and death. Trauma and tears.
You've broken that arm quite badly.
Supporting each other through the toughest shifts.
They need a medal in there.
Come on.
I feel like her off a Titanic.
This is Barnsley Casualty 24/7.
I cannot believe that.
1, 2, 2.
I'll get the biscuits out later on.
I love you. I love you.
On shift tonight, consultant Dr. Sue Mason,
Just have a little feel of your tummy while you're sitting there. I don't think this foot looks brilliant either.
Dr. George Kay,
I better be careful I don't annoy you and then you'll be chasing me down the corridor then, hadn't I?
consultant Dr. James Griffiths,
How old are you? 5.
and volunteer Jane Allen.
I've got a dab on. Oh, that's better. That's better. I feel like her off a Titanic now.
So get ready to share a shift
Have you fed the cat? What do you mean, sod the cat?
at Barnsley Casualty. It's early, but at Barnsley Hospital, the team in Casualty are already at full stretch. As they regularly have more than 300 patients passing through the doors each day, it takes a huge team effort to keep the department running smoothly.
Hello, it's Harriet.
This morning, Sister Harriet Lindley is coordinating the shift.
We are 2 nurses down, as you know. Jonta and Sam's in peds. There's needing 2 nurses in resources, 4 patients in there. I need a room.
Patients are streaming in, and already there's a demand for beds, and it's growing by the minute.
Are you going back into resources, Adam? When you come out, will you do me a transfer?
Hello, have you got a male bed on surgery, please? He's a man with haematuria and needs a bed.
There's been a sharp rise in the number of ambulances being called. Ambulances and their crews are backed up and queuing to get in.
I don't know how long it's going to be. It's going to be a 1 in, 1 out.
It's fine.
Just because we've got no capacity.
All right. Yeah, that's fine, no worries.
All right, and bye. When I see that the department's starting to get busy, there's ambulances on the back corridor that still need assessing, resus is full, there's lots of patients that have walked in to A&E. Going through my mind is kind of a strategy of how I'm going to deal with it, just trying to keep calm and keep a smile on your face, even if you don't feel like smiling. Lucy, can you take a cannula out?
The patient in cubicle 7 didn't want to wait to have his cannula out and has disconnected his own drip.
Pulled it out. It wouldn't wait, so he tried to disconnect it himself. It happens.
There's a risk from blood-borne viruses, so it's got to be cleaned up. With the department working flat out, it's up to Sister Harriet to sort it.
The vein, all the blood's just coming out.
Another ambulance is blue lighting someone straight to resus.
Any past medical history or anything else? Insulin dependent.
Junior Dr. Sam Burks takes the call.
Straight on to resus if needs. Thanks, buddy.
Taking the lead is Dr. Mason. Assisting her is Sister Benita Wainwright.
We might want to just order a chest x-ray as well fairly quickly.
Being rushed into resus is 57-year-old Roy, who was found unconscious at home.
Hi, do you want to come in here?
Paramedics think he may have choked on his own vomit.
This morning, unresponsive. Like we'd aspirated, we had to suction his airway out.
When we get patients into the resuscitation room and they are unresponsive, it can be a highly stressful situation. It's very important to keep your head and stay calm. I don't think the nerves ever go away, and I think that's probably a good thing. How much oxygen have we got going through?
Roy?
Right.
Roy?
If Roy has inhaled vomit, his breathing could have been affected, causing damage to his brain and vital organs.
Hello, Roy. All right, lovey. You're speaking to us, that's good. Good, he's biting on that. That's good. Hello, Roy. Good, good, good.
It's aspirated. Got vomit all over his face.
I don't know whether that's aspirate or snot.
She says he was unwell.
It's like phlegm or something, doesn't it? Can you find anything? This could be interesting. Is it?
Is he at home on his own, Carl?
No, he's got two lodgers he lives with.
And blood sugar all right for you, Carl?
Blood sugar 13.8. He's insulin-dependent diabetic. He has a carer comes in every day and gives him his insulin.
Any family? Do we know any next of kin?
The team are trying desperately to track down Roy's family.
So you've got blood pressure rated over 66.
Could just run that fluid through, that could be good.
Is he allergic to anything?
When you've got those under control, do you want to call for a chest x-ray? We could do
With nobody to explain what happened, it's difficult to work out what's causing his unconscious state. And he's deteriorating.
Let's get him on the bed. We can sit him up a little bit and see if we can improve on that. But his gases are not great. Get out of it.
For Roy, the next hour is critical.
Hello, it's Harriet.
At Barnsley Hospital, the pressure is on to get everyone seen within the NHS's 4-hour target.
Right, so get that one to Peas, likely home.
But there's been an unusually high number of ambulances arriving at Casualty. They're queuing and backing up. In Resus Bay 3, Dr. Mason is battling to save Roy, who was found unconscious at home. Despite their best efforts, his condition is getting worse. Moving Roy to a bed should make him more comfortable and help his breathing.
Where's hurting? Can you tell us?
That's better. Have you run an x-ray? They'll just need to come and do a portable, really, so, yeah. Well done, lovey. Just have a little feel of your tummy while you're sitting there. Not keen on that, is he? That's all around there. I think we need to get critical care down. Be up to notify next of kin as soon as possible. Oh, hello, are you on for critical care? Hi, it's Sue Mason, one of the A&E consultants. I just wonder if you could come and have a look at a guy who's come into Resus just about 20 minutes ago. 57-year-old man, he's 30 stone, insulin-dependent diabetic. Found this morning in a collapsed state, covered in what looks like sort of mucus, really, to me. He's responding, not really speaking to us, not opening his eyes, not moving a great deal, but I don't know how much he moves normally. It's difficult to assess that for him.
Roy's next of kin have still not been traced.
Assume that he, even though chest x-ray didn't look too bad, that this is probably sepsis.
If he doesn't respond to treatment, time could be running out. There are still more ambulances than usual arriving at Casualty, and space is becoming an issue. On his way to Resus to get ready for their next arrival is Dr. K.
I think that's an interesting thing.
This one piece will make 52 layers.
Watch on mobile devices or the big screen, all for free. No subscription required. Download Veely now.
Paramedics have rushed in 85-year-old Margaret. They've given her steroids, but she's still struggling to breathe.
Hold on tight. You're going to have to lie. 4, 3, 2, 1, go! Right, this is Margaret. Margaret is 85 years old. Last 3 or 4 days had increased shortness of breath with a productive cough, sputum. She's a smoker. When she's walking, she has really short breath.
Okay.
Speaking sentences.
Perfect, thank you very much.
I'm more commonly known as Pearl.
Do you prefer to be called Pearl then?
Yeah.
Is Margaret your Sunday name if you've done something wrong?
That's my real name,
Yeah.
Margaret. But everybody calls me Pearl. It means, Margaret means something pure. Pearl.
Oh.
You didn't know that, did you?
I didn't. But what we're going to do is we're just going to hook you up onto our monitor, do your blood pressure and everything, okay?
Okay.
And then we're going to have a little look at you and then try and get you feeling a bit better and get some blood tests done. Is that all right?
Yeah, some stickers are all right, sweetheart.
I think the whole bedside manner and things helps throughout everything. And we don't have long to do that, we only have a few minutes. And it just helps them trust you a bit more.
So how long have you been poorly for? Is it just the
4
last...
days.
And do you normally have much of a cough, or is that...
Yeah, I've always had a smoker's cough.
And what made you phone for the ambulance today?
Because I knew there was something not quite right.
Was it because your breathing was just getting that much worse?
I was so weak.
Yeah.
Yeah, that was the main thing. I couldn't do what I wanted to do.
Okay.
Yeah.
And who do you live with at home normally?
The cat.
Anyone else?
And he's bloody useless.
Oh, I wouldn't go that. I'm sure he gives you good company, doesn't he?
Well, yeah.
And how many do you smoke?
Well, I've cut down a lot. I reckon about 8 a day. But these last few days, been virtually nil.
And how long have you smoked for? Since you were a teen?
Not doing it.
And how many years young are you now?
85 years young.
So probably about 70 years you've spoken for?
No, because I was an athlete at one time.
Oh.
What did you used to do? A sprinter.
Sprinter?
I better be careful I don't annoy you and then you'll be chasing down the corridor then, I don't know.
To get to the bottom of what's caused Pearl's breathing difficulties, she's going to need more tests. Her condition could turn out to be serious.
Ambulance crews all the way up that corridor.
As more ambulances join the queue, Sister Harriet manages a shortage of both space and trolleys.
All right, I need a male surgical bed.
To keep the flow of patients moving, she'll have to call upon her years of experience.
The personality traits that you need to be a coordinator in A&E is being able to multitask, work under pressure. I think working in A&E can be really difficult and challenging both emotionally, mentally, but I couldn't see myself working anywhere else now.
Within Barnsley Hospital, there's a dedicated children's casualty. Heading there, and hoping to relieve the backlog of patients, is Dr. Griffiths. Waiting to see him is 5-year-old Charlie, with his parents, Jane and David.
Are you Mum and Dad? My name's James, I'm one of the doctors. What's been up with Charlie?
I think we touch a croup.
Okay. And have you had a sore throat, Charlie? Any high temperatures?
Felt hot.
Last couple of days of temperature again. It's his birthday today,
Oh! How old are you? 5! It's rubbish being poorly on your birthday, isn't it? My little boy was ill on his birthday. We've got photos from his party, he's all green, sat there with his big birthday cake in front of him, and he's just green. Being a parent, it helps you as a doctor because you can understand that family dynamic. You understand some of the anxieties of the child and of their parents or their carers. And so you can use your own experience to try and put people at ease. Can I have a look at your chest then? Would that be all right?
Charlie's already been given medication to help with his breathing and ease his nasty cough.
And can you open your mouth really, really wide? We'll have a look inside. And can you say, ah? And any rashes or spots or changes in his skin that you've noticed?
I've noticed something now.
So he's got a spot on his butt.
Oh, we don't look at that, do we? So it's usual sort of croup stuff really. Hopefully the steroids will work for the next 24 hours. Obviously keep his fever under control, make sure he's drinking plenty. Any problems fetch him back, but hopefully now he'll be all right and be okay for school in the morning. Do you want to see if we've got a sticker for your birthday? Because you've been brave. You treat paediatric patients differently and children will often respond well to a sticker or bubbles or blowing up a rubber glove and making it into an elephant or a cockerel or something. That looks pretty cool, doesn't it?
Thank you very much.
All right, you're very welcome. Hope your birthday gets better. See you later.
Bye.
Bye.
Right, is there no beds and surgery either? Have you heard about them? All right, thanks, bye. What's that? I best investigate then. Do you think it's in waiting room? Someone in here? Are you pulling buzzer? Oh, just press it in. All right. Let's see if it's gone off. That might have fixed it. Hello, it's Harriet.
In Resus Bay 2 is 85-year-old Pearl. She was rushed in by ambulance, fighting for breath.
Right, can I have a little listen to your chest and things? Is that all right?
Feel free.
Treating her are Dr. Kay and Nurse Kim Gibson.
I'm just going to borrow your hands first of all. I'm just going to have a quick feel of your pulses. Your heart's racing a little bit, isn't it?
I don't feel as breathless.
That's good. Right then, should we get some bloods off you?
Oh, bloody hell. Not much to give.
I need to get your chest area, is that all right?
What the bloody hell?
Oh, it's all my bits and bobs.
Spaghetti junction here.
Wires all over.
Hey, and what would we do without you? That's it. And we grumble about the health service, but
What would we do without him?
So I'm just going to borrow this little vein here, if that's okay.
Don't worry, I'm not going to get you.
no, there's not much to see.
Sound like mine, Anna?
I'm only a shadow of the person I used to be. Hey, you're laughing.
That's what my Anna thought, yeah.
I used to miss out door girl at Pontins.
Did you?
Yeah.
So, listening to your chest, and with you having the cough that you have, I think you've got a chest infection or a pneumonia.
I understand.
I've done some special blood tests here to see if we get any bugs that grow in your blood. Okay.
Better not be.
Well, exactly. So we're going to give you some antibiotics and some fluids now. You're obviously needing a bit of oxygen, and we'll get an x-ray of your chest while you're in here as well. You'll be staying in hospital today, I'm afraid. You'll probably be with us for a few days.
Oh, no.
I know.
No.
But we need to get you sorted, don't we?
What about my cat? Homer.
I'm afraid we need to look after you, don't we? Because if we don't look after you, you'll not be in a position. You won't be able to look after Homer either, will you?
No.
So we need to get you sorted.
Yeah, I understand.
You what, love? You want a cup of tea, Margaret?
I love one. And a bag.
Well, listen, I can't offer you that at the moment. Do you want milk, sugar?
2 sugars, please, and milk. And then can I phone my daughter?
You can bring your daughter now if you like.
Right.
Yeah, you can use phones, that's fine.
I'm in hospital. Have you fed the cat? What do you mean, sod the cat? Okie dokie. Yeah, ta-ra. She's on her way, so they're all on the way. I've been invaded. Aliens.
Pearl may be making light of things, but Dr. Kay wants to get her breathing and heart rate under control. She's not out of danger yet. Every now and again, volunteer Jane goes through all the items left behind in the waiting room
We'll go through this bit this morning.
and tries to reunite them with their rightful owner.
Sop liquor. What's sop liquor? Who's been drinking this? Which one of you's been drinking this morning? Is it? See, you see? Well, I think I'm going to put this down to think. I think it's just going to be too much temptation, isn't it, for him? It's going. Gone. Cheers, whoever it is who left it.
Ambulance crews are backed up and waiting to hand over their patients.
Hiya.
It's up to Sister Harriet to clear the backlog, free up some space and get ambulances moving again.
They're coming down to collect him. Yeah, so get him ready. They'll be here in a minute.
In Resus Bay 3, Dr. Mason and her team are battling to save Roy, who was found unconscious and unresponsive at home. He's still dangerously ill.
Morning.
Dr. Sugrat Siddiqui from Critical Care has been called in to assist.
So, this gentleman found undeterminate amount of time that he's been down for, not on the floor, not fallen to our knowledge, not injured himself, just found by his landlord. We don't know how mobile he is normally, not great looking at him. We're giving him antibiotics for aspiration pneumonia just because of the story and not being quite clear what was going on, but he's a penicillin allergic. We've had to give him quite a whack of ticaplanin, I think, yeah, because he's 190 kilos. Can we try, Tobias, get hold of Mum or GP.
Any green notes or...
Find out if we've got any more information on him.
Should we get on some BiPAP while we're waiting?
Yeah. Should we get the BiPAP out then?
The BiPAP mask will keep a constant flow of pressurised air to Roy's lungs and support his breathing.
I don't think this foot looks brilliant either. Try. Oh, hello, it's Sue Mason, one of the A&E consultants here.
With my hand for me.
I've got a guy in resus, a 56-year-old man, not really responding to treatment, so we've had critical care down here for a while. We've popped him on some BiPAP, we've given him lots of fluid, he's had some atramanol, he's had lots of antibiotics, and he's not responding at all. If anything's deteriorated slightly.
With no sign of improvement, Roy's children are rushing to be by his side. Halfway through the shift, and there's no let-up in people needing to be seen.
So we'll get that one to P's, likely home. Someone's getting that three-way catheter for resus.
Seriously ill patients will always go straight through to resus.
Dennis, we're just waiting for that bed to be ready.
But with Barnsley Hospital's one-in, one-out policy currently in operation for non-emergencies, as one patient is discharged, only then can the next waiting ambulance crew hand over their patient.
Right, help me move these two patients around, will you?
I managed to burn toast again.
As always, volunteer Jane's doing all she can to share the workload with the staff of Casualty by helping make the patients feel as comfortable as possible. 93-year-old Lillian has been brought in by husband Horace. She's been very short of breath.
Just turn the toaster off. What fire brigade coming, do we?
While they wait to find out what treatment Lillian needs, Jane's helping to make them both feel at home.
Shortcut.
With a bit of Yorkshire charm.
They are my cherub, that's yours. There's your toast here, there's a bit of toast here for you if you want some, all right? Okay, look, can you reach it all right? Yes. So just to look after her, because you're not doing a right good job, are you? Oh. Eh? I said she might need to change her in for a newer model. How long have you been married? 73 years. 73 years? You must have only been 10 when you got married.
I was a child bride.
You were a child bride? 98. Sorry?
He's 98.
Are you 98?
I am, yeah.
I'm sorry, I've got to say this, you don't look it, sir. You don't honestly look it. You must be about 65.
I'm 93.
Well, that's lovely.
I can't move my legs.
Well, my husband would like me to get to 62 and not be able to move my tongue. He said it'd be a lot quieter if I can't move that. So, look after yourself, my darling.
Any pointers on cooking?
Any pointers on cooking? Ironing?
Or shopping?
I have to come to you.
What, be dining down again?
Well, can I send my husband then? Because he's just retired and he definitely needs pointers on cooking, ironing, shopping and everything else. So I'll send it to you. All right, love, see you later.
Okay, sweetheart, let's just pop this on.
Back in Resus Bay 3, Dr. Mason and Sister Benita are desperate to see some improvement in Roy.
Just sit next to her and I'll get her to come and have a word and kind of update you with what's going on.
Roy's son Luke and daughter Kim have rushed in to be with him.
Hi, I'm Dr. Mason, I'm one of the consultants.
Dr. Mason must update them with the news that no family wants to hear.
So, the current situation is that he is very, very poorly, I'm sorry to tell you. It looks as though he's been like this for quite a long time, so a number of hours. As I've got older, breaking bad news has got harder for me. He hasn't really responded very well, apart from when we've moved him. He's obviously been in pain around his tummy. The problem at the moment is that we've given him quite a lot of treatment and he hasn't shown any sign that he's recovering. Even though I am more experienced at it now, I find it more difficult to deliver bad news. I think just because I can understand how difficult it is for families. And I do sometimes get quite emotional. At the moment, it's not looking good.
Roy's children prepare for the worst. Working his way through an ever-growing list of patients that need to be either admitted or discharged is Dr. Griffiths. Waiting to see him in the paediatric assessment bay is 10-year-old Kobe.
Hello, who's this? My name's James, I'm one of the doctors. What have you done?
Shot me under my finger.
Okay, how did you do that?
In a gate.
Rightio. Can I take a look? Yeah. Are you going to look away? Should we like put one of these on it? Okay.
See it.
Okay. You're doing really well.
What are you going to do?
Now, I'm just looking. Yeah.
Just having a look.
Okay. That's fine, you can cover it back up.
They've brought Kobe's fingertip with them.
Is the rest of it in here somewhere?
Yeah, it's stuffed up to bag of peas, probably. You have to show them your skin and your peas.
It's too small to... That's fine. But, you know, you can probably still eat your peas. Are you sharing it?
Their peas.
Do you want to keep it as a souvenir?
Yeah, put it in a little box.
So, we'll get you around for an X-ray. Okay, I think it's probably gone through the bone as well, but we just need to be certain. Or we can chop it off at the elbow. Good plan. Have you had some medicine? No. Would you like some? Okay, we'll get that sorted out for you as well. It won't take it away completely, but it will help. Do you feel up to going around to X-ray? Right. I'll give you that.
I can't.
Should we give these to Dad?
Yeah.
Thank you very much.
There you go, Dad, hold your finger.
I've got your finger. So much bigger than that.
An X-ray should reveal if Kobe has caused any serious and long-term damage to his finger. In the heart of the hectic hub, Dr. K is keen to share his wedding plans.
Are you wedding saving?
Yeah.
Aww.
It's fine, it's only a few thousand, mate, it's fine.
Where are you getting married again?
I'll show you the church.
Yeah. Is it a quaint and cutesy? Oh wow. It's a quaint and cutesy.
And then,
So why this church? Is it her family down there? Is it randomly?
it's the village next to where she lives. There's a church in her village, but it's too small.
Is
It
it?
can only have 100 guests.
Roy was blue-lighted into rhesus in an unconscious state and was deteriorating.
Bizarrely, he has got a little bit better. So. They look a bit better. His blood pressure has gone up a little bit. Things have stabilised a little bit. There are always patients who come in looking dreadful. Somehow they rally. And it's really incredible how resilient the human body is.
And Roy continued to show signs of improvement. After 4 weeks' treatment and rest, he was well enough to return to his own home. Volunteer Jane knows Casualty inside out, and there's one item that's the bane of her life.
Pillows, for whatever reason, they keep disappearing. There must be a pillow mountain somewhere. I haven't found it yet. I will try. I don't keep looking. I keep going on different wards, and I think they've got Sustum in there because a lot of them lock them up.
Oh, yeah, Benita. Tom Cruise. Mission Impossible. Don't ask where I've got them from.
I don't steal them. I redistribute them to the A&E.
I'll put a cover on it.
I don't know where they are. Go to. I've got a dab on.
Can you fan me? Yeah, fan me.
You're like a Roman princess.
Oh, that's better. That's better. I feel like her off a Titanic now.
Along the back corridor, there's still a backlog of ambulance crews and their patients waiting to be seen. The team in Casualty pull together to keep things moving.
Not easy, this. There's a whiskey in it.
To find out what's causing 85-year-old Pearl's breathing problems, she needs a chest X-ray.
I'll leave you with X-ray, all right?
But because she's so poorly, they are coming to her.
So, you've no bra on, have you, sweetheart?
No, I've got no to put in it.
Neither have I, don't worry. I'm going to sit you forwards a bit, all right?
Yep.
So, in a minute, all I need you to do is take a deep breath and hold it, all right? Breathe in for me.
Hold your breath. Breathe normally, darling. Lovely.
Can I go home now?
How long do I have to do these on? Just because you're being quite poorly, so just need to keep an eye on you, all right?
Come on in and enjoy the bloody show. What are you here for?
I'll leave you with it. All right.
So, who are these gentlemen you've got with you?
That's my son, Robert.
Yep.
Mr. son, Kenneth.
Hi, nice to meet you both. My name's George, I'm one of the A&E doctors, all right. So, I was just coming back to speak to you about your blood tests and your x-ray, if that's okay. So, your blood tests show you've got an infection.
Right.
We knew that anyway. Okay. Your x-ray shows you probably do have a patch of infection on this right-hand side where your crackles were.
Something untoward there.
Chest infection and pneumonia are the same thing. One we just see on an x-ray and one we don't. So the treatment's the same. I know.
Treated the same.
Yeah.
Antibiotics.
So we just need to get you up onto the ward. As a general rule,
yeah, it's safer to be in overnight.
So you need to stay in because your heart's still racing and you're needing oxygen. So I can't let you go home if you're needing oxygen.
She's obviously told me she's a smoker.
Yes, yeah.
I'm surprised that the doctor hasn't told you. At your age, you should know better.
I've already done that. Yeah.
Yeah.
We've already told you off, haven't we?
Yeah.
It's not about quantity of life, it's about quality, isn't it? Is it?
Smoking affects the quality of life.
Well, yeah, that's true. You don't want to be in here every month, do you?
And eventually the quantity as well.
No.
Because that's what we see with a lot of people that have been smoking all their life. They're in kind of every 2, 3, 4 weeks. And I would argue that probably isn't a good quality of life. But got an infection. Yes, we know you have pneumonia. But actually, you're looking better than when you first came in, which is good.
Okay.
I'll feel a bit better.
Good.
I felt terrible.
After 10 days on a ward, Pearl was well enough to go home and was reunited with her much-loved moggy, Homer. Paramedics are handing over to nurse Sophia Egan 94-year-old war veteran Bert, who's injured his ankle.
His core is right cut off, with his walking tray causing a laceration there.
Bert's worried there's something seriously wrong.
Since then, right leg's been increasingly swollen. 2 days ago, he's attended here again, sort of clarification.
Bert's neighbour Penelope has come along for moral support.
Sort of like discoloration red, he's gone further up his calf towards his knee, increasingly swollen, struggling to get around.
I don't know if you're allowed to eat.
I hope so.
You can have something to eat if you want. If you wait till I move him into a room though, and then you know where he's going to be. All right.
Right then, Bert. All the best. Take care. All right. Nice to meet you. See you.
So I'll find you a room. We'll do some bloods on you.
Which one?
You might not go to a ward yet, but we'll see what happens.
You'll be around, won't you?
You're very pretty.
Oh, thank you.
She's lovely, isn't she? Come here.
Have you got a cannula in your arm?
Overseeing Bert's treatment is trainee advanced nurse practitioner Chantel Proctor.
I'll see you shortly.
Hello. I'm Chantel, I'm going to see you, okay? So what brings you here today?
That my ankle.
All right, okay. What's been going off? Give me a bit of history.
I caught it on my walker at bottom with steel.
When were this?
About 2 or 3 days ago.
Okay.
And now it's come up, and this morning it was really swelled.
Did you come in to see us 2 days ago?
Yeah.
For the same thing?
Yeah.
Okay. And what did we give you?
Antibiotic.
Have you got them with you? Let's have a nosy. Is it in this bag?
Yeah.
Let's have a look. We've come prepared. Not these. What have you got in here?
Oh, so much.
You got a torch?
I didn't put these in.
I think you're planning a sleepover, aren't you? You're prepared.
You look at that and I'll look in this.
Right, oh, I found it. These.
That's them.
Okay, and you've been taking them for a couple of days?
Yeah.
And it's not got any better?
No.
Okay. Right, Who do you live with? On your
Myself.
own? Are you fully independent?
More or less, but I've got a friend that's come with me. She's going to get me a sandwich.
Oh, right, okay, that's fine. Have you ever smoked, Hubert?
Yeah.
How much?
I finished in 1975.
Okay. How long did you smoke for?
I went to army in 43, that's when I started.
How long were you in army for?
Nearly 5 years.
Were you?
I was at Normandy veteran.
Were you?
Yeah. And I've got highest medal that you can get in France.
Have you?
Yeah.
What's that medal?
I don't know how to pronounce it.
Go on, have a
I
go.
forgot.
Have a go.
When my friend comes back, she'll know.
What's this?
Mother.
What is it? How many have you got?
It says mother.
Oh, your mum?
And that says father.
Oh.
Now,
When did you have them done?
When I went to the army.
Okay.
And that one, I come on leave and I was in Barnsley, I was drunk, I don't know who put that on.
Right, I'm going to wash my hands, okay. Are you in pain now, Bert?
Not really. It might be because that other nurse gave me a cuddle.
Right, so it's this leg?
Yeah. There, that side.
Ah, right, okay. Does it hurt?
Yeah.
Sorry. Right, so this may be a collection of blood called a hematoma that's causing a bit of pain, or it might be a collection of infection, okay? So I will have a look at your blood, we'll have a chat with consultant and we'll come up with a plan. All right?
Yeah.
Would you want some more pain relief?
I'm not worried, you shall.
Pain relief or a cuddle? I'll go find that nurse.
Cold
94-year-old Bert has done nothing but laugh since he arrived, but a serious infection could be life-threatening. Because it's so busy, Barnsley Casualty are operating a one-in, one-out policy. But ambulance crews are still waiting and new patients are still arriving by other means.
Well, you'll get the patient in ADC 2 and bring him into resource, and I'm bringing the patient out into there.
Back at the hub, lead nurse Hannah Ryan is helping to keep things moving.
We need capacity, we need to be able to move out and we need people to move out.
In exactly an hour, I'll have a gin in my hand. You won't though, will you?
10-year-old Kobe chopped the tip of his finger off in a gate.
Thank you.
He's had an X-ray to check for any damage.
It says it don't look like it's damaged bone, but the doctors will check. Hey, can you grab that bloody tissue? No, it's not swearing.
It's 19 years old, it's bloody tissue.
Oh, it's bloody tissue. I don't know where I am. We're just past it. We've gone the wrong way. We've gone the wrong way.
Despite his injury, Kobe can still point them in the right direction.
Yeah, we have definitely got past this. We've definitely gone too far.
I've no idea where we are.
Where did this thing got to the back from?
That looked promising, that way.
Studying his results is Dr. Griffiths.
So on his X-ray, it looks like it's not quite as round. He's just like shaved the tip of his toenail bone. He's coping with it very well.
Kids at that age are a bit like salamanders. They tend to grow back when they chop things off. So although it looks horrific for the child and the parents and they're all freaking out, you know, from experience you know that it's going to be fine.
See, where are you?
Okay, just have a sit down for me. Just in this one.
Dressing Kobe's wounds is nurse Kate Ellis.
We're going to give it a little clean. Okay. Just got to give it a little wipe because it's been trapped in a mucky gate, hasn't it? Might be a little bit uncomfortable, but I'll be as quick as possible, okay?
She's got to clean it.
Got to clean it because we don't want it to get infected, alright?
Can I squeeze onto your hand? If you must. I'm scared.
Because look, it's got fluffy bits stuck to it already.
Are you doing that to my nail?
To the end of your finger. You're doing a really good job. Don't worry, I'm not going to cut your finger off.
Not more.
I won't go to all that effort with that bandage if I were just going to chop it off. So does that feel okay? Yeah? Can you wiggle your finger a little bit for me?
Perfect. Sorted. So keep it nice and dry. Regular pain relief for him because it will be sore, alright? And we'll get you an appointment to make the card. Right. Lovely, come this way for me.
Come on, fat finger.
Sure.
Colby was able to go back to school the next day and went on to make a full recovery. The same can't be said for the frozen peas. Dr. Mason is on her way to acute dependency cubicle 1. 93-year-old Lillian was brought in by her husband Horace, who was worried about her breathing.
Right, how are you doing now?
Better than I did.
You want to tell me what it was that brought you in?
I couldn't breathe.
And did you get any pains in your chest at the time? No. Right.
I didn't want to bother you like that.
And the doctors, I've had a little look at all your notes and everything, and the doctors have said that you've got this valve that's leaking and a bit of heart failure, so you're basically the heart's not working very efficiently, is it?
No, that's right. I'm all right. The tablets are working, so
Yeah.
it's okay.
Really, it's just a question of us checking you over when you come in,
That's right.
making sure that we're happy and trying to get you home again, really. That's what we'd like to do.
Yeah,
Is that right? You've got a good helper here. Good. The number of patients that we see who are well into their 90s, living independently and really pretty fit is staggering to me. I am pleased to tell you everything's fine. So your blood tests look good, actually. In fact, they look pretty much as good as they've looked for a long time. So I think we can safely send you home. Now things have settled down. The next step is to get you some transport home. Quite often it is hard to not to get attached to certain elderly patients. And I have to say that Barnsley people are fantastic.
The team in Casualty have been battling to reduce the backlog of patients waiting to be seen and free up some space.
Hiya, it's Harriet in A&E. We've got a lady coming up to your bed. Have no pain, accepted by surgeons. Okay, thanks, bye.
Their hard graft has paid off.
If there's a lot that need to go to the ward and we finally get them all off to the ward, it feels like just clear my mind and gather my thoughts and then ready for the next big influx.
We've got one on back corridor, we've got them all in.
The one in, one out system has now been lifted. So the team are back on schedule. In cubicle 9, 94-year-old war veteran Bert is upbeat, but he's waiting to hear whether the wound on his leg needs treatment or if he'll need to stay in hospital.
Let's have a little look at your leg and see what's going on, sir.
Aspect of his leg.
Nurse Chantel has asked consultant Dr. Barath Reddy to double-check her diagnosis.
Is that painful?
Yeah, he's on a Pixie-ban. His inflammatory markers are okay. Bloods are normal. I think it's just superficial. Yeah, hematoma and a bit of inflammation.
I would leave it alone.
Yeah, I think so. So, we're going to send you home.
Go here.
Veteran hugger Bert is now healing well, and since he got home, he hasn't stopped laughing.
I'll meet you in there.
It's been one of the busiest shifts that Sister Harriet can remember. Last job of the day, the handover.
It has been a really awful afternoon, to the point that we ran out of trolleys and ran out of places to put patients as well.
Any good news, Harriet?
Oh, no. I can't even think of it. Have you anything to add, Hannah?
I've got some good news. It is better than it were. There's less of a backlog in there to be transferred. So hopefully when you go out there, the next few to go should be ready because I've just asked them to get them sorted as I've come round.
With the problems of the day sorted and everything back on track, Sister Harriet can head home and celebrate another memorable shift with that well-deserved G&T. Next time on Casualty 24/7.
Barnsley A&E.
And is this the first time he's had one of these shaking episodes?
How come there's only 39 patients in the department and it feels like there's 79?
You just relax. Imagine you're somewhere nice.
That's the issue, my love.
Somebody will realise me.
You're far too cheerful to be an A&E.